Welcome to All's Talks. I am Dr. Elizabeth Edgerly, Senior Director of Community Programs and Services with the Alzheimer's Association. So happy to welcome you to our February All's Talk. The mission of the Alzheimer's Association is to lead the way in ending Alzheimer's and all other dementias. Our focus is on accelerating global research, driving risk reduction and early detection, and maximizing quality evidence-based care and support. Allstalks webinars provide education, information, news, and resources on a whole variety of topics related to dementia and caregiving. And this webinar today is supported by Eisai, Eli Lilly and Company, and Roche Diagnostics Corporation, and arranged by the Alzheimer's Association. We want to thank our sponsors for supporting this work and this program here today. It's my true pleasure to welcome our speaker for today's session, Dr. Rebecca Edelmeyer, Vice President of Scientific Engagement, Medical and Scientific Relations. It's always a pleasure for me to get to hear Dr. Edelmeyer speak. She does such a wonderful job putting things that are pretty complex in a way that I can understand and then go tell other people about. So thank you, Rebecca, for joining us today to talk about a topic I know you care about, which is biomarkers.
Absolutely, Elizabeth. It's wonderful to be with you all, and you are absolutely correct. This is one of my favorite topics, and I'm really excited to be here today to share more about what's going on in the research space and how they're being used today.
Awesome. So let's get started. Here's an easy one for you, maybe not as easy for the rest of us. What is a biomarker? What does that even mean?
I think that's a great first question to start off with, but I would bet that almost everyone listening in actually knows what a biomarker is. But the way I like to describe these is it's really an objective way for doctors and even researchers to be able to understand changes that might be happening in your body. And biomarkers can give a variety of bits of information to a doctor. And you could think of biomarkers as something that can measure like brain imaging. For example, you could think of biomarkers as something that we could measure in the fluids. And that tells a story about what's happening in your body, the changes that might be occurring. It could be telling a good story, it could be telling something that might be some warning signals, but it really allows clinicians to have more information about what's going on to help make a diagnosis or even help to support different treatment options.
Hmm. Okay, so it includes imaging, fluids. So if I get, my blood drawn, that's an example of a biomarkers being read for something, but there's a whole host of fluids.
Exactly,
Okay.
exactly. You could think of biomarkers like in a variety of different ways. We've even heard of different types of tools like digital biomarkers. Sometimes people use that term, and we're learning a lot about our physical activity from the things that we track with our watches, right? Or
Mm,
those rings that we
yeah.
wear. But I think today, where a lot of the research is happening in the Alzheimer's and dementia field, is biomarkers associated with things that we can read on a brain image, pictures of the brain, things that we can read from our blood or cerebrospinal fluid, which is that clear fluid that bathes your spinal cord and brain. And they tell, again, a story about changes in the proteins, changes in other factors that might be circulating in our systems, and
Wow.
changes even maybe even in the structure of for example, in our brains, what we can learn from brain imaging.
Wow. It's amazing. So let's get to the specifics then. And when we talk about biomarkers and Alzheimer's, like what does a biomarker test have to do with diagnosing Alzheimer's disease?
So biomarkers have really been making great advancements in the field in terms of what we're learning from them regard through research. Now, when we think of biomarkers, I noted some of the more studied biomarkers that really came into being were the ones that were associated with brain imaging originally. We used to
Mhm.
look at magnetic resonance imaging, or you've probably heard of MRIs. That's an example of us being able to look at the structure of the brain tissue and any changes that might be occurring. And we've learned in Alzheimer's disease that the brain shrinks in areas of the brain that are really important for our memory, our thinking, and learning. And we can see that when we look at brain imaging. And that's an example of a biomarker, so some changes in the structure. We also know that there's been a lot of research done in looking at changes in proteins and other substances in what I call the cerebral spinal fluid. That's another example of a fluid that can be attested for Alzheimer's disease and other types of dementia. And they look at the different levels of those markers within the cerebral spinal fluid that can be drawn out of the body through what we call lumbar puncture. That's a very common procedure that can be done with an expert who knows how to do that kind of lumbar puncture to draw out those fluids. And then you can measure the different markers in the cerebral spinal fluid. And that can indicate changes that might actually be associated with changes in your brain tissue. And then we've seen more advancements, even more recently, in the types of biomarkers associated with blood testing. And as another example, we can look at the blood and measurements within the blood of different markers to sort of see if those changes would be indicative of Alzheimer's disease or some other types of biological changes that might be happening in the brain to cause it dementia. So it's really important right now for us to continue to do that research to understand what each biomarker may be able to tell us. But these tests are not done in isolation. And I think, Elizabeth, you know this very well, but I think one question we get so much is, can a single blood test or can a single biomarker test tell me if I have Alzheimer's disease? And the answer to that question is really no. We use biomarkers as part of a combination approach to really doing a thorough evaluation of someone, to really try to understand what's going on in the body if someone is having some concerns about their memory or thinking. And it's done also in combination with functional and cognitive tests as part of that thorough evaluation. So biomarkers are really important, but they're not the only way for us to learn more about what's going on in the body.
Yeah. Okay. So not in isolation yet, maybe someday, but at this point, it's part of the whole picture, is what I heard you say. Could we go back for one sec because you mentioned lumbar puncture, and I'm going to guess that some of the people here today are like, okay, I'd like the blood test, please. I really, I don't know about that lumbar puncture, but eh, as we'll talk about, sometimes it's hard in some communities to get access to everything. Um, the lumbar puncture, it's like it's done, you do it and then it's done and valuable information from it, right? So like yeah, should we be that scared of getting that test done if it's going to give us information? I mean, what are your thoughts on that one?
I think that's a great question. And we do have a lot of people that say, "Oh, I'm scared to get a lumbar puncture." And I would really encourage people to have a conversation with their clinician and their doctor about what their fears might be about getting a test like this done, because
Mhm.
it is really important to know the facts about what the tests do,
Yeah.
what we're measuring, what the procedure looks like, and to truly understand both the potential for side effects, but also the benefits from learning the information that can come from a test like that. And what we've really learned from the science is that we talk about how tests need to be developed, validated, standardized, right? To be able to, for us to have reliable information out of them. Lumbar punctures and cerebral spinal fluid testing is something that is really key it's a key tool for clinicians to be able to help aid in the diagnosis of Alzheimer's disease and other types of dementia. And what we've really
Mm.
learned from the research is many times we can measure things in cerebral spinal fluid much better in the cerebral spinal fluid than we can in blood initially, right?
Right.
So the research maybe starts in cerebral spinal fluid, but then research advancements happen and progress is made, and then we're able to measure them very reliably in blood. So there's always going to be a need for these cerebral spinal fluid tests and imaging
Mm.
as part of that diagnostic process. But as you noted, it would be
Yeah.
wonderful if we had a blood test for everything, right?
Yeah.
We're not there yet for all diseases that cause dementia. And it is important to know that you want to make sure that your doctor can use every tool in their toolbox that they have available to them, which would then be hopefully available to you, to be
Yeah.
able to help you make the most informed decision possible. So again, I think I would
Great.
reiterate, talk to your doctor about any questions you might have about any of these procedures, because it's really important you learn the facts about what the procedure is, what
Yeah.
it can do to help you inform you and your family about your health conditions.
Thank you. I appreciate that. So, you mentioned other dementias just a second ago. Are there biomarker tests for other types of dementia, or are they only available for Alzheimer's?
So there are a lot of different types of blood biomarker tests and cerebral spinal tests, cerebral spinal fluid tests, and even different types of imaging tracers that are being developed today for not only Alzheimer's disease, but other types of dementia. And that's what's really, really remarkable is that those advancements are happening pretty quickly. We've probably seen the most progress in Alzheimer's disease because we also started understanding Alzheimer's disease first when it comes to some of this research and science. It is also one of the most common forms of diseases that cause dementia, right? But we are definitely seeing progress being made. And I'll give you one example. In particular, for Lewy body disease. Now, that's a different type of disease, neurodegenerative disease, that can cause symptoms of dementia. And for Lewy body disease, there are some new tests in development, and some are being used in the clinic already to measure a very specific protein, for example, called alpha-synuclein. And alpha-synuclein can be measured in the cerebral spinal fluid. And they're working on blood tests to measure alpha-synuclein too. But that's an example of where we do have some tests that are now going to help us to hopefully either differentiate Lewy body disease from Alzheimer's disease, or to be able to diagnose the presence of some of those biological changes in the brain that may be contributing to someone's symptoms. So I think the future state is that we would have different tests for all different types of diseases that cause dementia. And you might get all of those done at once to be able to
Wow.
really, truly
Wow.
understand what's going on in the brain, to be able to then inform what would be the best treatment approaches for you and what is your prognosis and how do you make sure that you're making healthcare decisions based on that information.
Wow. That, you think about how much people go through sometimes to get a diagnosis, and the idea of maybe sometime you go and you get a test, and maybe it is the lumbar puncture, but then you can see, is it Lewy body? Is it frontotemporal lobe dementia, or one of those types, or Alzheimer's? My mother was ultimately diagnosed with Lewy body dementia, and it was symptom based. We really consulted, but it would have been so helpful to know sooner. And if something like this was available, I think she and we would have jumped at the chance to know earlier because they're different. These diseases are different and the symptoms are different and the treatments are different and all that. So that's exciting. I can't wait. And I hope it's not going to take too long either, or maybe 5 years, 10 years, who knows? I know you don't have a crystal ball, but um, so when we think about diagnosing dementia, Alzheimer's, and other types, what kinds of tests, what are the current tools and tests that are commonly used? So if I go to my doctor to get a diagnosis, what tools would they use, and how do you see biomarkers kind of changing this process in the future?
So, what we typically see today, and I think, Elizabeth, you touched on this point, where even in your family, maybe a diagnosis was given before there was even biomarker tests
Yeah.
available, based just on the what we call the clinical symptoms,
Hmm.
right? Maybe some changes in memory thinking or someone's behaviors that are
Behaviors.
driving those
Yeah.
symptoms and driving that experience for someone that's living with dementia. But I think what historically, this has been pretty common for most families that they're only getting diagnosed based on symptoms. And that's really what we're trying to change with the incorporation of biomarkers in the diagnostic process. And I would say this shouldn't be unfamiliar to people. We don't
Mhm.
just diagnose diseases like cancer or cardiovascular disease based on symptoms alone, right? We
Mhm.
do all sorts of testing to truly understand what's causing the disease. How do we make sure that we're creating a targeted plan for treatment and care? And that's where biomarkers come into play now. So someone might experience today going into a doctor's office, or what we're trying to drive towards in terms of best practices at what people are experiencing in the doctor's office, is that first, any of those concerns about someone's symptoms, if they're experiencing any, or even if you have a family history, having that conversation with your clinicians early on so that you're kind of keeping an eye on the presence of symptoms, even doing some initial testing that might be helpful to understand sort of what your baseline cognition is, that would be important. But if someone's definitely having symptoms, you want to start with a conversation with your clinician. And that will require maybe some cognitive and functional testing that might be done to assess those features, especially when it comes to the symptoms. But if the clinician feels that it's important that we get some additional testing, this is where biomarkers come into play. So they're going to try to also rule out other reasons that would be cause for concern or something that could be causing any changes in symptoms, because there's a lot of reasons someone could have cognitive impairment. That could be caused by sleep disorders. It could be
Mm,
caused by metabolic disorders. It
yeah.
could be caused by even a tumor of sorts,
Mm.
right? It could be caused by
Medication
medication.
sometimes. Yeah.
Perfect example.
Hmm.
So there's always going to be these opportunities very early on in a diagnostic process where clinicians and the patients, we're going to be ruling things out to be sure that those are not the causes and would require a different form of treatment, right? So some even baseline blood testing, measuring, liver enzymes and all these kinds of things are going to be critical up front. But then once you start digging deeper and we're ruling out all of those other features, we're going to want to start potentially ruling in whether or not a neurodegenerative disease is the cause. And that's when biomarkers get incorporated too. So brain imaging is typically one of the first things that are ordered because we might want to see a CAT scan or an MRI just to be sure there's not a tumor or some kind of blockage or the changes in symptoms haven't been caused by a stroke or something of that nature, right? And we also then may order some additional testing related to PET imaging is another example. That would be one where we would look for very particular markers for Alzheimer's disease in the brain, looking at the beta amyloid protein or the tau protein in the brain using PET imaging. Or cerebral spinal fluid is another example where those biomarkers might be included. So looking for the beta amyloid and tau in the cerebral spinal fluid. Some clinicians are already starting to incorporate blood testing as well. So in
That's
places
great.
where PET imaging and cerebral spinal fluid imaging are not necessarily available, blood testing might be used by clinicians that have experience in diagnosing and treating memory disorders as maybe a first pass. But then again, sometimes those other biomarker tests are going to need to be included in that diagnostic process
Mm,
to be sure that you're able to confirm a diagnosis before it's given.
mm. Okay, it's a little complicated. One thing occurs to me, and I've heard this from actually several of our early stage advisors recently, is some of them have had the experience where they went in and they got a blood test, but they didn't know what the blood test was for. And it was related to Alzheimer's, but um, I guess there are different types of blood tests too. It's not just that there's a single blood test that is related to Alzheimer's. One of the things we encourage them to do is ask the doctor, what exactly is this particular test for? Is it one was a genetic test, actually, they were looking at. One was a test for amyloid. One was a test for tau. So, am I right? We're getting to the point where there's almost a little library of tests that could be done. And if you don't know what it's for, you're not going to know even what to do with the answer.
A fabulous question. And I think that you're absolutely right. And this is where the research is moving so quickly.
Hmm.
So we started talking a little bit today about the different types of ways that you can do biomarker testing, right? And I do want to circle back to the point that when we're talking about Alzheimer's specifically, right? We're talking about some of those key hallmark changes that are driving the disease in the brain or contributing to the disease in the brain. And many people hear about the proteins, the beta amyloid, right? The sticky beta amyloid plaques or the tau tangles. Those are tangled up proteins inside the neurons. And they hear about the nerve cell death or the neurodegeneration that's occurring in the brain. And that's what causes the brain cells to die and shrink in areas of the brain that are important for our memory, thinking, and learning. But the biomarker tests that are being developed today can measure many aspects of these different types of protein changes and also some of the changes that might be happening in the brain related to the structure. So when you said that there's not a single blood test, that's very, very true. There's not a single cerebral spinal fluid test, and there's also not a single brain imaging test, right? So
Yeah.
asking the doctor about what test that you're actually getting to measure some of the potential Alzheimer's changes in the brain are going to be important. And looking at the different types of proteins that might be measured in those different tests is going to tell you different information. One thing that we are learning too is not every test is created equally. Now, they are available on the market, but the tests may be designed to do different things. For example, there are two FDA approved tests, or cleared tests, they say, for Alzheimer's disease that can be used to test blood
Right.
biomarkers,
Yeah.
right?
Hmm.
And but each of those tests does different things. And the way I tried to bucket them in a way is they each measure different Alzheimer's proteins. But one of them is used to rule out Alzheimer's disease, which
Mm.
means that it has a high probability of giving you very reliable information of saying you don't have Alzheimer's disease. But the other type of test is used to rule in Alzheimer's disease, saying that with high probability, it's highly likely you have some of those changes that are associated with Alzheimer's disease happening in your brain. With a rule out test, this might be something that could be used in primary care, but it will require additional testing to be done, right? It's sort of a first pass or an initial test. With a rule-in test, it depends on other factors around your health and other testing that's been done. But with these sort of more rule-in tests, it can provide more information that can really aid in that diagnosis. You may still require some additional testing, but each test has a different sort of accuracy level that's going to be used by doctors in different ways. So I think the point you made, Elizabeth, is very important, is understanding from the doctor what is being tested by each test and what the information is going to tell you, and then what next steps might be following that test based on
Great
the
point.
information that you get.
Hmm. Yeah, and to think about it's not going to be a one and done a lot of the time. It's going to take a little time and patience and scary time. It's a scary time to go through this sometimes for people. So I appreciate that, Rebecca. So one thing I've observed, and I've heard this from a lot of people too, is it sometimes seems like there's a big lag time between when, hey, there's a new blood test, FDA approved blood test, and when it's actually available in my community, especially depending on where you live. Um, am I imagining things? Do you see that too? And what's up with that? Like, why does we hear it in the news and then it may not, it seems like you might not even get access for years, maybe even a
Mm.
couple of years.
Good point. So, and some of this is due to a variety of factors. Many times, when the FDA clears or approves a new test or even a new treatment, it can take some time to roll up manufacturing and distribution for some of those different types of products, right? But that's not always the case. Many times, it also is related to the ability of having those tests actually be available at the doctor's office, where the clinicians themselves may not yet be trained to even order
Yeah.
these types of tests and deliver
Oh,
the
good
results from
point.
these types of tests. So that's an example that has nothing to do
Yeah.
with the product's availability. It just may not be the services that are provided within the clinic that you're seeking your care. So that may require a referral. That's one
Hmm.
example, right, to a clinic that is doing this work. And in some cases, it may be related to the geography of where you're located. We know that there can be a lot of access issues for people that live in rural communities. So they
Hmm.
rely more on telehealth approaches, or there may be some travel that's going to be involved in being able to get that accurate diagnosis from a clinician that's trained. So When we
Yeah.
talk about access to all of these different types of tests, there can be many challenges, but I think it is important that we continue to share with everyone that we are continuing to make progress in this. And as we see new tests become available and approved to be used in clinics, we are seeing broader and broader access grow over time. We
Mhm.
see also coverage, right? Insurance
Oh,
coverage
yeah.
for those
Who's
types of
paying
things.
for it? That's a big
Right,
part of
that
it
can
too.
take some time
Yeah.
too. So there's
Hmm.
a lot of different things that we continue to try to improve upon once something is first approved to be used in humans and can be actually used out in the clinic.
Wow. Great. Thank you.
Mhm.
So who should get this kind of testing? I think you kind of covered this, but let me ask you specifically, like who are the best candidates to receive this kind of testing? Like if I'm concerned about myself now, I don't have any symptoms or anything, should I go try to get this test or one of
And
these tests that you're talking
yeah,
about?
so
Hmm.
this is an important question. We've been talking a lot today about what might happen in the clinic, right,
Yeah.
between patients and doctors. There's a lot of work happening also in the research setting too
Hmm. Yep.
on biomarkers and
Hmm.
how they're being used. And we want to make sure that we also understand there are differences of where these tests are, available and who they're a right fit for.
Hmm.
So when we're talking about the research setting, we see the tests being used in a variety of different ways. Sometimes they're even being used in people who do not yet have cognitive symptoms, but are living with some of the already key changes or key hallmark signs of Alzheimer's disease or even Lewy body disease in the brain. But that's happening in a clinical trial, right?
Okay.
So
Hmm.
these people are being followed and they're getting so many different tests done across a clinical trial setting where there's a lot of biomarkers that are being used not only to support a better understanding of the trial results, but also to carefully watch the study participants as they're moving throughout the trial. But how these different biomarkers are used in clinical settings is different today. So when it comes to a lot of the biomarkers that are available today, both the imaging biomarkers, the cerebral spinal fluid biomarkers,
Hmm.
and the blood biomarkers, they are all recommended to be used appropriately in people who are living with symptoms today.
Okay. So
That's
you have to
important.
have some
Some
memory
symptoms.
loss issues,
Yes,
decision
and
making. Okay.
yes, and that's really where we are today because they've been approved to be used really in people with symptoms. They've been reliably tested to be used in people with symptoms and to be able to
Okay.
provide those reliable and accurate results. That's not to say
That's
that in the
important.
future as we learn more from these clinical trials, they won't be used in different ways in the future, but we have to continue to do that research to support the evidence that drives how any test should be used in patients to aid in diagnosis or aid in the ability to follow a patient maybe taking a new treatment. And that is the
Okay.
same across any disease, even outside of Alzheimer's and other dementia. You wouldn't use tests inappropriately in people who weren't the
Yep.
right population to be using them in the clinic.
Yeah. All right. So those of us who are thinking, oh, great, I'm going to go get a test and find out 10 years from now, whether I'm going to get Alzheimer's. So we've talked about that, right? Being able to identify early, even before symptoms occur. But that's not ready for prime time yet. These tests are at this point for people with symptoms, except in research settings.
I would say yes. I think that's a
Okay.
good summary. I think if you talk to me in 6 months, that
It
that
maybe it'll
answer could
change.
actually change. I mean, like I said,
Okay.
we are moving very, very rapidly right now in this space, but I think one important thing to tell everyone is that it is a very exciting time for these biomarkers. So I think do not get discouraged about this. I think we really do see a future where these tests are used more broadly and they're being used very reliably to aid in diagnosis so that they can help support a quicker diagnosis
Yeah,
and more accurate diagnosis and get people on appropriate treatment paths. So
right.
it's coming, and that research is being driven across the globe right now. So it's really amazing to watch that progress. And so I don't think it's too far in the future where we will
That's
see
great.
this future state.
It has been going at breakneck speed. I mean, it's amazing just to see how many in like the last year or two. It's incredible. So, okay. So who, let's say I am trying to help my mom through this process. Like who would perform these kinds of tests? Where could I find them? Do you start with your primary care doctor or does it have to be a specialist? How does that even work?
So this is going to be slightly different for everyone. I'm going to generalize a little bit, Elizabeth, because everyone has different access to different
True.
doctors.
Yep. Hmm.
And I think what we tend to see generally, though, is that primary care clinicians are really at the front lines.
Hmm.
They're going to be the maybe some of the first people that you bring any concerns to when it comes to your cognition and function and any issues that you might be concerned about. So we do see that many times people are starting to have those conversations with their primary care doctors, and their primary care doctors in turn should be taking those concerns seriously. And if the primary care doctor starts doing some of those rule out tests that we talked about, that's usually that first step. The
Hmm.
primary care doctor may, if they have training, be able to perform some of these other additional tests. But if they don't have training, it might require a referral to a specialist.
Hmm.
So you will see, though, with different types of health system care these days, many times a primary care doctor could even get a PET scan ordered, but they might not be able to deliver the results to you. You would need to see a specialist to have that
Hmm.
conversation about what the diagnosis is. So we are seeing some challenges, I think, in the healthcare system and making sure that diagnosis happens quickly and
Hmm.
accurately. But I think it is important to note that if people are struggling with these kinds of conversations and being able to advocate for themselves as part of that diagnostic process, we always do encourage that they reach out to our organization. We're happy to help with
Yeah.
what are the kinds of questions should I be asking my doctor? What kinds of information should I be trying to get back so that I can make an informed healthcare decision and inform next steps for my family? So I don't know if Elizabeth, there's other things you'd want to add on to that, but I know it's
Yeah. Yeah.
challenging right now.
It is. Yeah. And it's you do have to be an advocate a lot of the times. And I love what you said because it often does start with your primary care doctor. And hopefully they can be a partner in this process and even just get you started. But being equipped with the right questions and to visit our ALZ.org website, I really like the section on 10 warning signs. In that, of course, you can look at what are the symptoms and all of that, but there's also some really great resources on what to ask the doctor, what to prepare for the doctor's visit. And there's also a whole section on partnering with your doctor. And so check that out. And we will include the links here as well so you can see where do I find this information. I think a little bit of prep on your part, whether you're doing this for yourself or for someone you care about, goes a long way because you often do have to ask questions. I remember when my mom was diagnosed, and I asked the doctor, it was a generic diagnosis of dementia that with no specific Alzheimer's, Lewy, but nothing. It was just dementia. And I asked the doctor, "Oh, I hadn't heard that before, and I know a little bit about dementia." And I said, "Oh, so how did you diagnose dementia?" And he said, "Oh, uh, well," and he hadn't done anything except a little bit of cognitive testing, no blood tests, no formal diagnosis. And he said, "You know what? I'm going to get you a referral right now." I always said he gave her the eyeball test, which is he kind of looked at her and said, "She sort of looks like she has dementia." So coming prepared with if someone is diagnosed with generic dementia, asking like, what type of dementia? What is causing those symptoms of dementia? Do you think it's Alzheimer's or Lewy body? And asking that will often result, I think, and I'd be curious what you think too, in the clinician saying, okay, hold on, this person is asking really good questions. I need to be ready for this. What's your sense of that?
I think it's really important to advocate for more testing if you have concerns. I think it's important to make sure that you're getting a confirmed diagnosis, as you
Yeah,
noted,
yeah,
so that you can understand what next steps would be and how you'd be able to then make informed decisions about your treatment or even care options. I'll just give an example here because many times people think dementia is a diagnosis, and
yeah,
technically it's not.
right.
So I want to do a little bit of an analogy for you. I'll use pain as an example, right? So you wouldn't walk into your doctor's office and then walk out of your doctor's office with a diagnosis of pain. Pain is not a disease. Pain is a symptom of a disease, right? That might be
Yeah,
going on or some kind of health condition that's going on in your body. You would absolutely ask your doctor, how can I find out what's causing this pain,
yeah.
right?
Hmm.
And they would do more tests to figure that out. So you have to think about that way when you're thinking about advocating for yourself in the doctor's office. What other tests, what other options are there for me to get that confirmed diagnosis? Because there's so many benefits to getting an early and accurate diagnosis.
Yeah. So say a little bit more about that. So there's two components to it, getting a diagnosis and getting a specific diagnosis. And I'm really glad you mentioned that because I think I bet you a significant percentage of people are still getting a diagnosis of a generic one, if they get any diagnosis at all. So two part, like, is it important to get a specific diagnosis? And then what about early, or I would actually say timely diagnosis? So where you can still actually maybe do something, whether it's treatment or otherwise. Say a little bit more about what you're seeing there.
For sure, an accurate diagnosis is important across the continuum of the disease. But as
Mhm.
you said, I think a timely or sometimes stated as early diagnosis is very important. And there's a lot of different benefits, both medical and social benefits
Mm,
for and reasons for this. You can think of a few examples of, you know, having a true understanding of what is causing your symptoms while you are still early in a disease process is going to be key on you being a part of making really informed decisions for yourself about what you want in terms of treatment options and what you want your
absolutely.
care options and planning options to be for the future. And you can think about these as also being financial. You can think about planning with your family. You could think about also discussing all of the potential options for new treatments that might be available to even slow
Hmm.
down the disease process that are really only available for people who are in the early stages of disease. So prolonging a diagnosis is not necessarily going to help you have access to some of those new treatment options. Making sure that you also have the ability to potentially participate in clinical trials. If
Great point.
treatment options
Hmm.
that are available aren't a right fit for you, this is a great opportunity to be able to potentially have access to new treatments or beneficial opportunities to participate in research that also have some of that social benefit too.
Yeah.
And so there's a lot that can be done with a timely and an accurate diagnosis. So I think that is, I think, just a few reasons. I don't know if Elizabeth,
Yeah.
you have other ones
Those are
that you want to
great.
add.
No, I really like what you said. And I just keep thinking about that it is a challenge to get a diagnosis quickly. It tends to take a lot of time. And so it's important for everyone to ask questions, to be appropriately assertive, to advocate, and also to go equipped knowing that there are emerging tools that in theory could make this go a little bit more smoothly. And so be on the lookout for that to see if you can do that. Because if you do want access to these treatments, they are by and large for early. early Alzheimer's at this point, and there's gonna be other treatments for other dementias, and there are, they're emerging too. So I guess time is really of the essence, and so you got to go for it. Is that what yeah, we,
Yeah.
let's go for it. Ask those questions. Um, all right, we are winding down here, Rebecca. So one last question. What it makes you most excited about this particular area of study, about biomarkers, this hot area of research right now? What makes you most excited? What do you think is going to come in the next few years?
I think I've said this already, but it has been an incredibly remarkable time for biomarker research over the past few years. I joined the Alzheimer's Association about 8 years ago now, and I have to tell you what I've seen happening even just in the last 5 years, I could have never predicted.
Yeah,
We now have blood tests that are available, and they're making remarkable advancements. We're seeing more and more different types of tools being developed for imaging, and more tools being able to be developed for what we were talking about, this sort of differential diagnosis, being able to differentiate between Alzheimer's disease or frontotemporal degeneration or Lewy body
yeah,
disease, vascular disease. All different sorts of biomarkers are in development today. And I think that that's what gives me most hope is that these are things that are going to help to advance access to diagnosis. They're going to help advance access even to new treatments. And they really tell us more about what's going on in the body that's causing these diseases and these changes to us as people. So for me, the biomarkers I think are just an incredible field to be working in right now. We're seeing new guidance and recommendations that are helping clinicians to use these tools being put out there into public settings. The Alzheimer's Association is leading a number of these efforts because we can't just develop those biomarker tests. We actually have to teach all of the doctors how to use them too,
yeah.
which is really, really important. So it's an incredible time. And I hope you invite me back in 6 months and we can talk again and see where we are with biomarkers. It'll be after our Alzheimer's Association International Conference, and we know
Okay.
there's so much research presented there. So there's a lot more to come. Even after this summer. So I really very, very hopeful for this field, and I know it's going to really change the game.
Oh, awesome. It makes me excited to hear you, even hearing you talk about it. And it brings to mind with our early stage advisors. So we have our early stage advisory group and thinking about what these tests allow people to see. One of our advisors has been on treatment for the last year and a half, 2 years, um, is having regular PET amyloid imaging and just got the results that he's amyloid negative. If he were to go today, they'd say, there's no amyloid. You're good. You don't have Alzheimer's. He does have Alzheimer's, and yet he's able to see this in real time, and that was never possible until PET imaging. So just to think about what this future could be, with blood tests and other types. So it is an exciting time. Thank you, Rebecca, so much for your time and your insights and your passion for this work. We really appreciate you joining, and we will have you back. You know that for sure. And thanks to all of you for joining this discussion. We're so glad you could make time for this program today. I hope it gave you new information and some ideas on how to navigate this process. This webinar was generously supported by Eisai, Eli Lilly and Company, and Roche Diagnostics Corporation. Thank you to them for helping to make this possible. If you or family or friends are facing Alzheimer's or any other type of dementia, the Alzheimer's Association is here for you. We are available 24/7 to people who have questions or need support. We have our 24/7 helpline, and our number is 800-272-3900. We have specialists available around the clock, 365 days a year, ready to answer your questions and even over 200 languages. So we have bilingual staff and we also have translation services. Sometimes it really helps to have another person to talk through this, like what we were just talking about, to say, am I missing anything? What questions should I ask? So feel free to give us a call to learn more about the symptoms, the process, find local resources, etc. We have even master's level clinicians when it gets tricky and you need to really talk through some difficult problem solving or need some education, feel free to reach out to our free helpline and services. Our website is a plethora of information at alz.org. We have information on available treatments. Actually, a lot of what we talked about today. We have information on biomarkers, PET imaging, and all of that, and so much more. It's a lot, but we'll help you through it. So if you have any questions or looking for any particular resources, please also feel free to email us at alztalks@alz.org if there's topics you'd like to see us cover. Thanks again for joining us. That's a wrap here for our ALZ Talks on biomarkers. Thank you all and have a wonderful day. Take care.